So here are some of the tools that you'll need to do a complete neurological exam in a dog. I do my physical exam at the same time as the neurological exam, so I've included my stethoscope. I use a light source that's pretty strong. You want to make sure it's bright enough to constrict the pupils, and even a small flashlight would work. This is my indirect lens. It's a 20 diopter, and I do a retinal exam on every animal as I'm looking at the eyes. For stretch reflexes, I use a pleximeter, and for the hemostat, I'm looking at the cutaneous trunk-eye reflex. Some people use their fingernails, but I get a better response, I think, and more accurate using a hemostat. So I start the cranial nerve exam. I actually go in the order that they're numbered. Many times I will hold my hand in front and see if they at least try to smell. It's hard to know actually what they are smelling, but the other thing I'm looking for is any kind of head bob or if they bump into my finger, which would be abnormal. And then I want to check the visual responses. So I cover one eye and I'm looking for a nice menace response. I have a menacing gesture and I get a blink every time. Sometimes I'll go at different angles, but I want to make sure that he is visual, and it does seem like that reflex is intact. You want to make sure you're not going too strong where an air current can actually make him blink and it's not testing his vision. Then I'll move on to pupils. And I want to make sure both pupils are normal size and appropriate for the exam room light. So I shine the light down the nose and look at both at the same time, and they are symmetrical. And then I want to look at one pupil and make sure it constricts completely, and then look at the other one to make sure I get a consensual response, and I do. And then I check the opposite eye and make sure I get a consensual response. While I'm looking at the eyes, I also look at the sclera and make sure there's nothing abnormal there. And then I take my indirect lens and do a retinal exam. So I usually have my fingers on the animal just to steady myself. And I hold the lens about an inch from the eye and parallel to the cornea. And then I inspect the entire retina, and that looks normal. I'm going to check the movement and sensation of the face and head. So I usually start with the eye and do a palpebral response both medially and laterally, and he can feel it and he is appropriately blinking. The blink is a complete response. Pinch the upper lip and he has a nice lip retraction there. Lower, sometimes you don't get much of a response there, and that could be completely normal. And then I want to see if the ear can move. And some dogs are just used to the owners playing with the ear and they won't move their ear. And if you don't get a good response, you can always call their name and you get a little bit of a movement, but there's certainly no ear droop. The other thing I want to do is palpate the entire head and make sure there's symmetry and no muscle atrophy or lumps or bumps to be concerned about. I want to retropulse both eyes and then palpate the entire skull, and then I go eventually and palpate the entire neck all the way down the trachea and make sure there are no masses. I also want to check salivary glands and then lymph nodes for any enlargement. Next, I'm going to do an oral exam, so I want to make sure the gums are nice and pink and he's well hydrated. I'm going to look at all the teeth, and the tongue looks symmetrical. There's no atrophy or lumps or bumps. And then I want to check his gag response, and he's got a good gag response. He's trying to avoid me, and it doesn't take very much stimulation to get him to gag. His jaw tone and make sure there's no problem there. There's no difficulty opening the jaw. He's resisting just a little bit. There's certainly no trismus. To check the oculocephalic motion, I usually like to be behind the patient. That way I'm not distracting him. And I just hold the head and move slowly side to side. I want to make sure the rhythm of the eye is the same in both directions. Okay. Then what I want to do is put the nose straight up and look for any strabismus or any nystagmus in that position. And that looks normal.